Hi, everybody. So today I'm going to provide you with the first of 10 practice questions for the initial certification final exam. So we're going to go over 10 questions. I'm going to read through them, and then I'm going to go back to the top, and I'm going to tell you what the answers are. The reason that we do them this way is because some people are auditory learners, some people are visual learners, and so I'm going to go through and just read them, and then we will give you the answers. And remember, what you're looking for is a pass rate of 80%. And there are 10 practice questions. So if you get 8 of 10 correct, or 9 or 10 correct, then know you are on track for passing the initial exam. Okay, so let's go ahead and look at these questions. Okay, number 1. The sympathetic and parasympathetic are two branches of A, the central nervous system, B, the autonomic nervous system, C, the limbic system, or D, the emotional regulation process. Number 2, which of the following is not a common mental health diagnosis for trauma survivors? A, major depression, B, generalized anxiety disorder, C, schizophrenia, D, post-traumatic stress disorder. Number 3, as a certified trauma recovery coach, it is ethically inappropriate for us to treat A, the disabled, B, the elderly, C, single parents, or D, minors. Number 4, we do not conduct a detailed intake interview during the first client session because A, we don't need to know in-depth details about our clients. B, clients might be uncomfortable giving us that information in a first session. C, our first priority is to establish our clients are safe by conducting a safety risk assessment. Or D, we will probably receive records from another provider that have all of that information. On to number 5. Which part of the brain related to emotional processing is enlarged as a result of developmental trauma? A, the hippocampus, B, the amygdala, C, the prefrontal cortex, or D, the brainstem. Number 6, anchor trauma is defined as the first trauma in a client's life, B, the most recent traumatic experience, C, the most significant traumatic experience, or D, a traumatic experience involving water. Number 7, as a result of trauma, many survivors will develop A, allergic reactions to vaccines, B, dyslexia, C, epilepsy, D, autoimmune disorders. And number 8, which of the following is not an element of the lying triad and its dark guard, which are the primary lies our abuse or trauma teach us? A, we are to blame for our abuse. B, we should be ashamed. C, we will never recover. And D, we are powerless. So 2 more to go. 9, the escalated care protocol is triggered by A, a client being actively suicidal, B, a client no-showing for a coaching session, C, a client coming to a session while under the influence of illicit drugs, D, a client complaining about our coaching services. And finally, question 10. Interpersonal trauma is defined as A, trauma that occurs on the job, B, trauma that occurs during armed conflict or combat, C, trauma sustained within the course of a relationship, or D, trauma sustained while one is an adult. Okay, so that's the first set of 10 practice questions. And again, these are pulled directly from the test question bank. So you might see some of these on your test when you take the test. So it's really important that you give yourself that edge, that competitive edge of going through and studying these questions and knowing the answers. So number 1, the answer is B, the autonomic nervous system. Number 2, the answer is C, schizophrenia. Number 3, as a certified trauma recovery coach, it is ethically inappropriate for us to treat D, minors. 4, we do not conduct a detailed intake interview during the first client session because C, our first priority is to establish that our clients are safe by conducting a safety risk assessment. 5, which part of the brain related to emotional processing is enlarged as a result of developmental trauma? That is B, the amygdala. 6, anchor trauma is defined as the first trauma in a client's life. So that is A. 7, as a result of trauma, many survivors will develop autoimmune disorders. That is D. And 8, which of the following is not an element of the lying triad and its dark guard? And that is C, we will never recover. And for 9 and 10, 9, the escalated care protocol is triggered by a client being actively suicidal. And 10, interpersonal trauma is defined as trauma that is sustained within the course of a relationship, and that is C. So again, I hope that you at least got 8 out of 10 of those correct. And if you have, or 9 or 10 correct, then you are on track to pass the initial trauma recovery coaching exam. Okay, thanks everybody. And we will put up another set of 10 questions next week.